So I'm the CEO of Arrow Child and Family Ministries. Arrow is a faith-based nonprofit. We're a large child placing agency that's statewide. We also are the SSCC in Region 4 in Senator Hughes area in the Piney Woods. And I want to talk a little bit about the problem that we're seeing. So our insurance coverage options for general liability, professional liability, and abuse and molestation have changed dramatically over the last 3 years. The policies have moved to claims-only coverage versus occurrence-based, and that requires us to purchase a tail in order to cover our exposure. We have done a lot of different things to try to manage costs. We've played with our deductible. We start in 2022, we had a $5,000 deductible. Now we have a $100,000 deductible. As we look at what our costs have escalated from, in 2022, it was $650,000 for those three lines of coverage. And 2025, it's $2.2 million. Those are including the tails. I broke it down because we have had some growth during that period of time to really kind of take the growth out of it. So the premium per census has gone up by 112%. The premium per FTE has gone up by 102%. And I'm worried that underwriters are just going to move out of the market. We've seen that with regards to a lot of states, and it's happening from a national perspective. The big piece for me right now is we have no competition. Right now, we have one underwriter that will bid on us. In the last 3 years, we've had 2 of those years that we only had one underwriter bid on us. We had 1 year where we had 2 underwriters bid on us. So what they pitch us is what we get, and that's it. Also had a provider that I talked to about coming into Region 4, opening up some capacity for treatment foster care. They talked to their insurance company, and their insurance company said they would non-renew if they did that. And so it's affecting capacity, it's affecting services for high needs kids, it's affecting costs. And I want to reiterate that I don't see this as an immunity bill at all. I think if somebody does something wrong and they harm a child, they need to go to jail, they need to be prosecuted, that provider needs to be shut down if there are things that they have done that have harmed a child.
Position on the bill, and you may begin.
Yes, ma'am. Thanks, Madam Chair. My name is Rachel Walters. I'm the Senior Director of Public Affairs for the Texas Alliance of Child and Family Services, and we support SB 1558. Thank you so much for bringing this bill forward. We're very grateful, Senator Perry. You heard from Scott directly his experience as a provider and how critical this issue is for foster care here in Texas, but the bottom line on this bill is this: if the state was running these residential facilities or managing our foster families, they have immunity. And our foster care providers stepped up to do the work because the legislature redesigned how we do our system. They do it because they're passionate about kids and families and they want to serve them well. And they have very limited protection under the law today, and Senator Perry's trying to clarify that for us. There's no explicit coverage for them to do the same work that the state would do and serve the exact same children. The state requires providers to get liability insurance to make sure that, one, that victims can bring suits if they do experience harm, but that, two, so organizations wouldn't be bankrupted by those suits or settlements. The risk to the providers in the state, if no legislative action is taken, is significant. And it's really hard to understand in our current environment why any insurance company would offer coverage when damages could be astronomical for things outside of an organization's control. We believe that because these organizations do the work of the state and because they perform a critical function in a highly regulated industry with extreme and even duplicative oversight, Senator Sparks, they do deserve some protection, not the same protection, just reasonable clarification in the law so that they can purchase and maintain the required insurance. The bill ensures that these providers are clearly covered under CELA, which would cap their liability damages, and the bill, like you said, Senator Perry, provides that separation between an employee perpetrator and employers who had no way of foreseeing that their employee would do harm. I
Thank
have
you.
3 minutes, I'm sorry.
You had one more sentence?
Nothing in the bill changes the hundreds of pages of minimum standards, contractual requirements, statutory direction, TAC rules that our providers adhere to. This is not about absolving them of oversight or regulation. It is about ensuring that they can do the critical work that they do today.